The National Institute for Occupational Safety and Health, or NIOSH, was created under the Occupational Safety and Health Act of 1970 as a research institute focused on the study of worker safety and health and empowering employers and workers to create safe and healthy workplaces. It has more than 1,300 employees spread across the United States from a diverse set of fields, including medicine, epidemiology, nursing, industrial hygiene, safety, and many others. On April 1st, 2025, 873 of NIOSH researchers, scientists, administrative, and management staff lost their jobs. These are workers who investigate firefighter fatalities, scientists who handle the testing of helmets and N95 masks, and researchers who examine all aspects of how workers are injured, killed, or fall ill due to exposures at work. They even study mental health outcomes from stress or violence at work and the ways to make life better at work. Occupational injuries cost U.S. businesses $1 billion per week, amounting to over $58 billion per year in direct costs. NIOSH's work contributes to ensuring that workers are safe while conducting hazardous work across all industries. During the COVID-19 pandemic, for instance, we protected frontline workers by certifying N95 masks and helping develop guidelines for indoor ventilation so that teachers, nurses, meat packers, food production line, and other line workers could get through the day safely. Let's hear from some NIOSH researchers who lost their jobs on April 1st and the ability to help reduce work-related injuries.
Hi, I am a research epidemiologist in the Division of Safety Research at the National Institute for Occupational Safety and Health. Our division was recently cut, along with all of my other colleagues in other divisions at NIOSH. I started at NIOSH as an Epidemic Intelligence Service officer during the COVID-19 pandemic. In my time at NIOSH, I was able to examine how workers are killed and injured on their job. In one of our studies, we examined severe injuries among oil and gas extraction workers, and we found that contract workers are more likely to be injured than permanent workers or operators at oil and gas extraction facilities. So why is this important? Well, me and my colleagues understand that work is a social determinant of health. And what that means is that work contributes significantly to your well-being, your quality of life, and overall how you live. And we learned that contract workers are less likely to have workplace protections and are less likely to have benefits and are more likely to be hired for more dangerous work. Our work in the Division of Safety Research calls needed attention to who are injured and killed at work and how that occurs at work. And then we generate recommendations to prevent workplace incidents from occurring. Our recommendations are often used to develop policies that protect workers. We also look at the systems at play in the causal mechanism and how this occurs. With NIOSH gone and the Division of Safety Research gone, who will examine these systems? Who will call attention to the trends in workplace safety and health? We would like to continue to do our work on behalf of workers and on behalf of the American public, and we need your support to do so. Please call your congressional representative and tell them to stop the reduction in force currently occurring at NIOSH.
And I'm a research epidemiologist at NIOSH, the National Institute for Occupational Safety and Health, and I've worked there for nearly 7 years. I've been part of 2 divisions during my time at NIOSH. Most recently, I joined the Division of Safety Research in December, But before that, I worked in the Spokane Mining Research Division, focusing on miners' health. As an epidemiologist, my work involves using data to understand what kinds of health issues are affecting certain people so we can keep them healthier and safer. In my case, I've worked with some of high-risk groups of workers, miners and firefighters. Mining is dangerous. A lot of the health problems that miners face don't show up right away. Things like chronic pain from repetitive motion, hearing loss, and lung disease all take time to develop. In the US, we don't really have a system in place to track those kinds of long-term issues. So my work involved using existing data, like national surveys and other data sources, to piece together a better picture of miners' health, so we could identify where help was needed the most. When I moved to the Division of Safety Research, I started developing a new project focused on firefighter safety, specifically looking at how human factors, human decision-making, and error contributed to injuries and deaths on the job, and how we can build tools that help prevent them. Firefighting organizations from all over the country were excited to partner with us. They really saw the value in the work, and they really wanted this research to happen. And the idea that this work might just stop before it even starts has been really difficult, given the amount of support that it received. On a personal note, I grew up in a small town where people work really physically demanding jobs, often for their whole lives. My parents even met working in a factory. And so when I talk about workers' health to me, I'm not just talking about data. I'm talking about people I know. I'm talking about people I love. I'm talking about people who give so much of themselves just to provide for their families and keep the country running. And they are people who deserve to be safe and healthy, not just now, but for the entire time they're working, and then they deserve to retire healthy as well. So NIOSH is important because it fills a unique role. It is right at the intersection of government and science. We don't just publish research, we turn research into action, into recommendations for policies and protections for workers who keep this country running. And even if it weren't me doing this work, which I've absolutely loved my job the entire time I've had it, but it's not about me, it's about needing NIOSH. NIOSH is needed, the work is needed, and I just hope that we don't lose sight of that most of all.
Because they have been saving coal miners' lives the entire time NIOSH has been in existence, and on behalf of all the coal miners in this country, thank you and
to this health and safety of the American worker. On April 1st, as part of the Doge and billionaire class agenda, RFK Jr. began terminating over 90% of our staff, effectively shutting down our agency. If this is allowed to proceed, it will have a devastating impact on every single working person in this country.